If you're here, it's because you're getting an arthroscopic surgery. This means that a surgeon is taking a small camera and exploring one of your joints through a small incision about the size of a buttonhole. This is done under general anesthesia, which means you'll be completely asleep during the surgery and will not feel any pain. You may also be getting what's called a nerve block. This is where the anesthesia team numbs your arm or leg prior to surgery. While the incisions for arthroscopic surgery are usually small, we're able to do a big surgery through them, which can cause a lot of pain, and I'm going to go over some of what to expect after your operation. It's normal after arthroscopic surgery to have significant pain in the operative extremity. You may also have some chest soreness if you're getting a shoulder arthroscopy. You should take acetaminophen or Tylenol and Motrin, which is also ibuprofen, around the clock as directed on the bottle for the first few days after surgery, alternating about every 4 hours to keep your pain under control. It is also good to get extra rest, avoid activity that doesn't feel good, and use ice and warm compresses for a few minutes at a time over the incision sites. You've also been prescribed a medication called oxycodone that you can add for additional pain control. Pain is normal after surgery, and most people are surprised at just how painful arthroscopy can be. If you received a pain block, be aware that the numbness can wear off quickly, around 18 to 24 hours after surgery, so be prepared to take oral pain medications. We don't want you to get behind on pain because it can be difficult to catch back up. Remember, zero pain is an unrealistic expectation after surgery, but we do want you to be comfortable enough to function. Your incision will likely be covered with a sterile dressing and small adhesive strips called steri-strips. Please avoid soaking underwater like baths, jacuzzis, or swimming pools until your incisions are completely healed or cleared by your surgeon, typically around 2 weeks. The steri-strips will fall off on their own in several weeks. Once that happens, you don't need to put anything over the incisions as they will be completely healed. After surgery, you may gradually increase your activity back to normal. Make sure to follow your surgery-specific activity instructions from your surgeon or physical therapist. You may be in a sling or a brace after surgery, and it's important to follow your after-surgery instructions about activity. You may drive once you're no longer taking oxycodone or narcotic pain medications and feel that you can safely hit the brake in an emergency without severe pain. Here's what to do if you have questions or concerns after surgery. For the following concerns, please call the Denver Health Orthopedic Clinic number on your screen or reach out to your surgical team on MyChart. Please call us if you experience pain that is getting worse despite rest, ice, and over-the-counter and prescription pain medications, nausea that is not going away after trying food, fluids, and rest, any concerns about your incisions, including liquid draining from the wounds, redness, and swelling. If you have the following symptoms, please consider calling the orthopedic clinic, or outside the weekday hours of 8 a.m. to 5 p.m., call the nurse line or come to a Denver Health urgent care location. Here are some common concerns about your incisions: drainage, redness, or skin separation, wound questions or concerns, very severe uncontrolled pain despite medication, rest, and ice. If you have any of the following symptoms, please call the nurse line or come to a Denver Health urgent care location: redness of your incision that spreads rapidly along with fevers, feeling ill, chest pain or discomfort, shortness of breath, chest pain, difficulty breathing, high fevers over 101.5 degrees Fahrenheit, especially if you have confusion, severe abdominal pain, or inability to care for yourself with high fevers, flu-like symptoms, or confusion. Again, please do not hesitate to reach out to our team if you have questions, concerns, problems, or if you didn't receive a scheduled appointment for our clinic. We can be reached at the number on your screen or through MyChart under the name of your surgeon. Thank you for choosing Denver Health Sports Medicine. We are with you for life's journey.